Planned Parenthood claims it provides women vital health services. It claims women need Planned Parenthood. Do women really need Planned Parenthood, or is touting that claim just a ploy to get taxpayer dollars? Consider this. If Planned Parenthood was so essential to women, why is it that it only performs 2% of manual breast exams and less than 1% of pap smear tests in the country? Why doesn't the organization have a single mammogram machine in its clinics? Why is it that even the services it does provide are so limited compared to what women can get at a regular doctor's office? Why is it that even its sexual health services like pap smear tests, STD tests, and breast exams have gone down year after year? Why has the number of patients that go to Planned Parenthood decreased from 3 million to 2.4 million in the last 6 years? If women can't do without Planned Parenthood, why has there been no women's health crisis after hundreds of Planned Parenthood clinics have shut down in the past decade? It claims to give women choices. So why are its prenatal services virtually non-existent? For pregnant women, the only service it offers them and their babies is abortion. Oh, but abortion is only 3% of what it does. Really? Then how did Planned Parenthood become the biggest abortion provider in America, performing more than 1/3 of all abortions in the country, killing over 320,000 babies every year? This leads us to believe that abortion is its bottom line, and the rest of its services are just accessories. So, it's providing fewer and fewer health services to fewer and fewer patients in fewer and fewer clinics. And yet, its abortion numbers have actually increased, and so has its taxpayer funding. Between 2004 and 2014, its funding more than doubled. Today, it still receives over $500 million from our government. But Planned Parenthood only runs about 600 clinics in the whole country. Isn't it funny how its significance has been so greatly exaggerated by the abortion lobby? Now there's something politically fishy going on there. Why should taxpayers fund this abortion giant when it's been mired in scandal after scandal? It's been caught covering up child sexual abuse for years, committing Medicaid fraud, and has a history of violating health and safety standards. And perhaps most damning of all, in 2015, an undercover investigation caught the organization selling aborted baby parts for profit. So why are our tax dollars funding an organization that treats human life so callously? The Department of Health and Human Services, or HHS, is still funding it. Look, I think we can all agree that women facing unplanned pregnancies need help. That's one thing HHS is for. It controls the money that goes to programs that could help women and children. But its own stated goal since President Trump took office says, HHS accomplishes its mission through programs and initiatives that cover a wide spectrum of activities serving and protecting Americans at every stage of life from conception. What? From conception? Then why is HHS still funding Planned Parenthood, whose business is based on aborting babies that are conceived? Between Title X, its family planning program, and Medicaid, the abortion giant is still receiving over $500 million in taxpayer money. Didn't Donald Trump run on a pro-life agenda? Didn't he appoint pro-lifers to head HHS? Yes, he did. But in practice, HHS is working against President Trump's pro-life agenda and its own stated mission. In the last 2 years, HHS has not done a thing that we can safely say has resulted in saving a single preborn child from abortion. Despite its pro-life rhetoric, HHS has failed to provide any funds to pro-life initiatives that would actually help women and their babies get the care and support they need. Making matters worse, the National Institute of Health, or NIH, which is under HHS, has maintained over $100 million in fetal research spending that experiments on aborted babies purchased from the abortion industry. The NIH has created a market and an incentive for Planned Parenthood and its allies to continue killing and harvesting aborted babies. Wow. In the words of undercover citizen journalist David Daleiden, it is sending the message that these children are worth more dead than alive. Are you as disgusted as I am? How can we stand for this when our own government is complicit in the sale of and experimentation on aborted children? The American people deserve an explanation. HHS needs to be held accountable, and funding for Planned Parenthood needs to stop. Perhaps President Trump should replace those at HHS with pro-lifers who will actually get the job done.